So, so a little bit about our presenter today. Gabby has worked for the nonprofit sector in the human services work for almost all of her career. Prior to retiring, she was a support and education coordinator at the Alzheimer's Society of BC. There, she worked firsthand with families caring for a person with dementia, supporting them as they supported their family member or friend. Then she was on the dementia journey with her mom, helping her dad do the intensive day-to-day caregiving while loving and grieving at the same time. She brings that professional and personal perspective on the caregiving role to her work and as a volunteer support group facilitator and presenter with the Family Caregiver of BC. Now she fills her retirement days by being engaged with a number of other community organizations, including the BC Community Response Network and Self Management BC, hoping to define the stereotypes around aging by example. And now I would like to pass it over to you, Gabby. Welcome.
Great. Thank you, Kelly. And thanks to everyone who's taken some time out of their busy days to attend the workshop today. I'm in the area known as Greater Victoria today, but was the original ancestral home of the Esquimalt and Songhees First Nations over on Vancouver Island. So let's get started with what we're going to talk about today. So I'm going to give you a bit of an introduction on Family Caregivers of BC itself, and then we'll kind of talk about the caregiving experience and why we feel it's so important that caregivers are supported in our community. And then we'll talk about a few strategies, including self-compassion as a really important part of the caregiving role that you're doing. So Family Caregivers of BC is a not-for-profit organization that is dedicated 100% to looking after the well-being of caregivers. We've been around for quite a while. We're BC-wide, but located sort of primary office here in Victoria. And there's really surprisingly only 3 similar organizations across Canada. We're also active on some national organizations that are starting to emerge that are also recognizing the importance of the caregiving role in the whole health journey for others. And we're now being supported gratefully by the Ministry of Health Patients as Partners program. So we can devote 100% of our attention and 100% of our funding towards programs to enhance the well-being of caregivers. So we work under 3 pillars: caregiver support, education, and the engagement and collaboration piece. Caregiver support means we monitor, we maintain a caregiver support line. It's not available 24/7. But it's certainly available, I believe, 7 days a week. And you can chat on any topic. You can get any kind of information. You can just vent and rail against the reality of things to the very helpful call takers on the caregiver support line. They will help you with maybe navigating our website or pointing you towards maybe some of our podcasts or videos that might give you the information that you need. We also manage a number of support groups. I run one called the BC Cafe, which means people drop in from everywhere, Prince Rupert to Nelson and right across the province. And we have a number of other ones. Some are dedicated to adult children caregivers of parents, and some other specialty groups. And we also have coaching available so if you're calling this support line, which is really the entry point to Family Caregivers of BC, period, they can explain the coaching program and possibly hook you up with someone who will see you for 3 to 5 sessions to help you establish whatever routines and get a handle on what the role is all about and how to break it into some manageable segments to help you moving forward. On the education side, our website is absolutely chock-a-block full of information sorted out by topic. So very easy to navigate your way through that. And as I mentioned, there's the podcasts and videos. There's newsletters, and we do have a newsletter that goes out sort of monthly, maybe quarterly, and it depends what's going on. And you're welcome to just go into the website or talk to the people on the support line and just register to get that information. Lots of helpful tips and articles and lots of resources that come your way. And as well, we do train people across the province to deliver support groups. So even if, you're in Prince Rupert and there's one agency, but that agency may have actually trained someone through Family Caregivers to be able to start up and operate support groups in your area. So you are getting very well-trained people throughout the province as they participate in the online learning, and then opportunities for continuing their learning through monthly community of practice sessions. And as today, I'm doing some outreach to different groups to explain a bit more about who we are. I find that we're one of the best kept secrets in the province, and absolutely don't need to be. We exist to help caregivers with all that's involved in this extremely important role. And then lastly, we are participating, as I said, on a broader scale as well. So our executive director is very engaged in, talking with health departments and improving health policy and making sure that the voice of caregivers is recognized when making changes in health decision making, right, at that sort of higher level. So that's kind of who we all are in a nutshell. And so that leads us to, who are you? Now, not everyone will immediately or easily identify as a caregiver. We often hear that, well, I'm a husband or a son or a friend, and, it's what I do. My parents raised me, and now I need to return that. What else can I do? There's nobody else around. I'm the only person that's available, perhaps. So they're just not really seeing themselves as, having this role called caregiver. So it's really important to actually stand up and admit that role in order to be recognized and in order to give voice to this very important job that you and countless others are doing. So here we, just define the family caregiver as someone who is supporting someone else living with disease, disability, or aging. It's definitely a challenging role, and there's no question that you folks understand that firsthand. Our executive director here, Barb McLean, has stated that many experience times of profound connection, deeply meaningful and positive experiences that are life-changing. So this can be an intimate, special, joyful time that two people can spend together. How big is this whole caregiving cohort? Well, the numbers are kind of astounding. There's 7.8 million caregivers in Canada that are doing unpaid care for family, friends, and neighbors. That's about 28% of our population. A huge number are young caregivers. 27% of Canadians between 15 and 19 years of age are young caregivers for parents and grandparents, actually. So 1 in 4 Canadians aged 15 and older are engaged in the caregiving activity. There's some kind of huge number, something like 52 billion hours that's contributed in the caregiving through across Canada, by the way. So, even from a financial kind of perspective, we're talking a huge number of unpaid hours that can be taken for granted by bigger systems, health authorities, and that kind of thing. But it also speaks to the fact that you are part of a big cohort and you do have a voice and you can make your wishes known and have someone start to pay attention to them. Another study that was done a few years ago now also estimated that employed caregivers are about 35% of caregivers. So, 1 in 3 people is also managing a full-time job or part-time job while they're doing their caregiving role. And about 21% of people spend 20 hours or more on caregiving a week. So that's several hours every day. You're part of the 1.4 million people in British Columbia who are doing caregiving, and our population, I think provincially, is around 5 million. So, easily 20% of the population can identify as a caregiver. So what do caregivers do? Now, this is kind of tough when we do this in this kind of seminar format because I can't really, ask for feedback, which I love to do from people, to hear about the variety of tasks that families do. I mean, here we break it out into some categories, right? Transportation, medical treatments, personal care. But I know that in each category, there's huge numbers of small tasks that all add up to being a lot. So within transportation, you're probably the person booking the taxis, booking the handy darts, being present to drop off your person with the handy dart, being present when they're returning home. With meal preparation, you're probably doing lots of special diets and perhaps even at a stage of assisting with the feeding. You're running your household now. So if you weren't doing the raking and the outside home maintenance before, you probably are responsible for that now. If you weren't doing the cooking and cleaning before, you probably are responsible for that now. There's running errands, right? The getting groceries, going out for meds. If you take your person with you, it's often a much slower activity, right? You're moving more slowly. It takes more time to get in and out of vehicles. You're looking at giving medications. You're looking at helping with dressing. You're helping with personal care, toileting, showering, getting dressed. And then if there's any wound treatment that has to be done, and you're going to appointments and doing the follow-ups. And through that, there's a whole piece of advocacy, right? That you need more hours from home care, and who's going to make that request but you, and how are you going to do that and follow up on it and so on, right? So we know that your days are filled. So that kind of leads to, what is being seen as a growing problem, and the Office of the Seniors Advocate in BC did a report a few years ago now, where at that time, Isabel McKenzie said, about a third of the caregivers in BC are in distress, not just feeling, stressed and busy, but they're in distress. And since 2017 they counted about 27% of caregivers. We can be pretty sure that that number is growing. I know that during COVID, when admissions to long-term care facilities were being cut off, people, especially those people looking after someone with dementia, were then expected to care for their person at a time when they probably should have been in long-term care with a whole team of people available. how can that not be, adding to the stress level of those carers? So, it's not only about the time, it's also about the money involved and just their own caregiver's own well-being, being physically and emotionally tired and overwhelmed on a day-to-day basis. Now, professionally, it's called caregiver burden. Not my favorite term, I have to say, but it does help to illustrate to others the weight in time, effort, energy that a caregiver has to carry. Every caregiver is going to feel this load differently. And, many caregivers do reflect on the positive thoughts they have about their role and how much it means to them to be so intimately caring for someone in a very special way. But, nonetheless, family caregiver certainly acknowledges that caregiver distress and burnout is quite real. Our support line, that's when people are finally calling when they're burned out, when they're really struggling with the challenges of their role. So again, here's where I kind of like to ask people to talk about some of the challenges that they're experiencing. But here's some of the things that we know about. Trying to do it all is a big one without asking for help. Not setting the boundaries is also a challenge, and also contributes to a lot of caregiver burnout. There's just that not being able to say no, or that being able to ask for help means that you're everybody thinks you're coping well. If you're not asking for help, then you must be doing okay. Just yesterday, I was doing my support group, and the discussion partly centered around, family challenges, family dynamics, and changing roles, and what to expect from family, and when family live in other provinces or live away, and how their comments on the phone are less than helpful sometimes. So, there's that definitely adds to the stress, and sometimes it creates guilt in the caregivers as to, am I doing enough, right? And I'm also trying to navigate, and how do I say no to a brother or sister, that enough's enough. I did want to highlight that ongoing grief and loss is a huge part of this caregiver journey. Again, yesterday in my support group, there were 2 or 3 people who have people that they're caring for in end stages of their disease process. And how they're still, they brought their person home from hospital, still undergoing chemo treatment in one case, and but it's stage 4, and it's very difficult, to see her person every day, her husband actually in this case, and how she's trying to, stay strong for him, but obviously anticipating the end of that journey for both of them, and how that's going to change her life, and how it's already changed his. And yeah, so grief on so many levels, and this anticipatory grief that caregivers live with, because most of the time these diseases, there is a trajectory that's evident, or that's inevitable. We also are hearing lots more in the last couple of years about the healthcare system too, and certainly acknowledge that it is challenging to find the specialists, to find parking at a hospital. I just recently went through that with my dad a couple of weeks ago, and that was one of my huge frustrations to going to visit him, that I couldn't even find parking. And after all the other bigger things you deal with, that's like the last straw sometimes. But yeah, navigating the system generally is, getting enough home care and home care hours and all of that is also quite challenging. And family caregivers is very, very aware that's what everyone is coping with, which is why we try to have a presence on with the policymakers in the Ministry of Health. So maybe you recognize some of these signs of stress. You can maybe experience some of them at different times, different ones at different times. Maybe all of them relate to you right now. The one that isn't on this list is very sadly abuse. And one of my other hats is as a coordinator with the BC Community Response Network, where we are helping communities recognize and identify in instances of senior abuse, neglect, and self-neglect. Huge problem around the world, actually. And when it often can happen with caregiver stress, can come, snapping too soon, experiencing some kind of, mental breakdown, coming to the end of your rope, whatever that might be, the exhaustion, the sleeplessness. Again, people talking yesterday about, answering the same question from their person with dementia 25 times. That's going to be a lot of stress. And the more exhausted you are, the harder it is to keep hold of emotions. And so then it starts with some yelling. It starts with being cross and being abrupt. And then it starts with, it progresses on to abrupt gestures. And yeah, it's unfortunately one of the outcomes that none of us want to see happen, and don't even think that we're personally capable of, but it can happen. There was a story that struck me a few months ago where they had found a man about 70, mid-70s, with dementia and COPD and lack of mobility. They had found him, dead at the bottom of a staircase. And then it turned out that he had been struck by his caregiver, his daughter, 40 years old, who had been looking after him since the mom passed away, 10, 15 years, but without a break, quit her job, abandoned her social system, and didn't reach out for any medical supports. And it had this huge tragic outcome. So we definitely want everyone to become as self-aware as possible, and in order to not go to that extreme. So we'll talk about that in a minute. So all this stress, and this is probably not news to you anyway, is that stress has a huge negative impact on the health of caregivers. You have up to twice the rate of developing illness or a chronic condition. High levels of stress means your body, your adrenal glands are producing high amounts of cortisol. And cortisol circulates in your system as this hormone to set you up for, fight or flight. And it's not a good hormone. It works great in short bursts to keep us, from being attacked or to keep us safe. But it also takes about 24 hours for cortisol to dissipate from the body. If you live in a state of constant stress, the cortisol never dissipates. And it's really hard on your heart, on your kidneys, on your liver, on your brain. We know that people living under constant stress have a compromised immune system, right? So they're more prone to getting illnesses and infections. They are much more prone to feeling depressed and to suffering from anxiety. And the sad reality is that 33% or so of caregivers die before the person they're caring for. So we know that caregivers then need a lot. They need information, they need resources, they need someone to listen to them. They need to be seen. They need to be seen by the care team. They need to be seen by society, not abandoned. You know, one of the hardest things I was listening to yesterday at my support group was the number of people who said, oh, my friends have just disappeared. My friends have stopped coming around because there's nothing, I don't have anything new. We don't travel now. We don't, have our other activities. And so we don't have anything to talk about, it seems. And so people are leaving us to ourselves. We know that the health team, all the health people around the person that you're caring for, absolutely that person needs to be the focus, but you as a caregiver are also part of the team. You're making a lot of these things happen for the person that you're caring for, and that needs to be acknowledged. We know too that how many are, as we said earlier in the stats, right? At least 1 in 3 are still working, and they're managing family at home and then possibly managing an older parent at their home or maybe in a care facility, which doesn't take away anything from the caregiving role, really. So these are themes that we at Family Caregivers notice and are trying to address in the pillars of support that we're offering. So why do we keep seeing these themes though? In the 30 years or so that we've been around, we continue to see this be part of the caregiving experience. Well, part of it is that very first slide that I mentioned, where family caregivers are not identifying. And so they're tending to get lost in the system. Secondly, the focus of care is on that care recipient, right? Or the patient or the client, and has not traditionally been inclusive of caregivers. And thirdly, people are not coming by, and this could be health people as well, who are offering more than one time. So you'll say, oh yeah, if there's anything I can do. And that's maybe the last time you ever hear from them. And it's the rare person, the rare friend or family member who keeps checking in and who keeps offering and who keeps doing even without being asked. Now, not all caregivers need the same level of support. It's all different for everyone. So it's important for caregivers to communicate that too, to identify that, yes, they are doing an important job. They're doing a big role. And yes, some help would be needed. And I want to put you on my list when I need some help. And what is that help that you're willing to provide? There's a program that we have with family caregivers called the Circle of Care. And there's a workbook that you can ask for to be sent, or you might be able to download it too from our resources online. And if you wanted some help with the coaches to help identify who is in your different circles of care, from the people closest to you to those more far away. What's your list? What's your to-do list, right? You saw some of those things on that slide earlier. Get really specific. What are all those things on your to-do list, and who could help with what? So it does mean, kind of taking some time and advocating for yourself by asking and not being shy to ask. So, at the same time, while we're working one-on-one, we're also, thinking that yes, our culture, our society has to change to include caregivers as partners in care, to recognize, sorry, I clicked that too soon, to recognize them and to acknowledge them, and to offer the supports and make sure that they are included in health decisions and other care decisions that are happening. Now, if you're attending this presentation, chances are you're in the marathon of caregiving. It's not often something you sign up for. It's probably not what you trained for, but it lands on you. And as we said, you just sort of do it. It's maybe what you thought you'd be expected to do. It's what you do because you have a big heart and lots of compassion. You do it because there's nobody else to do it. You feel like you don't have a choice sometimes. And then it becomes the new normal of your life. So, the pace is ever changing. Sometimes it starts gradually. When parents get a child that's born with a health issue like CF, or they have developmental delays. Sometimes it comes about unexpectedly as a result of a health crisis, a stroke or a heart attack. And I definitely had people who had experienced all of those in my group yesterday. And life changed for them on the snap of a finger. Or there was an accident on a ski hill or on a bicycle, or slipped off the curb and fell and hit their head. We don't know. It's unpredictable, and it's not going to happen at a time that's often very convenient. And it's adding to an already full life, usually without much room or space for more. And the way it changes life is something else that I find caregivers are grieving too. They had a vision of retirement, for example, with a healthy partner and kids and grandkids and travel and whatever the joys are that are suddenly completely changed, but that dream is still there, and that dream is also having to be grieved. So, sometimes, well, we can do it. We think, oh yeah, this is piece cake. I'm strong. I've done harder things. I raised 3 children who all under 5 years old at one point. Sure, this is a piece of cake. And we can start pushing our boundaries and, not paying attention. And then maybe we get through the crisis okay and find out that the marathon is just beginning. And what if this pace never ends? Well, again, question I'd like to pose to you, but the points that I am looking at are isolation, right? So losing your social circle, having some type of mental breakdown, perhaps, depression, your own illness, hospitalization, and the person receiving care is not getting what they need either. And I don't think that's what anyone intends. So it's becomes about self-awareness. Taking your caregiving temperature is the first way to be aware of how you're doing. Understanding how you feel is the first step to coping with stress. So becoming aware of your thoughts and your emotions will help you to know what self-care strategies to include. Self-awareness is going to allow you to know what your inner thoughts are and how strong they are as well. And it's going to help you to figure out what resources you have around you. What can you do? What should you do? What shouldn't you do? So that's the very first step, is knowing what's going on for you, acknowledging how you feel, naming it. If you feel resentful, name it. It's not popular, and maybe it's not a word you want to say to anyone else. Some point you need to say it to somebody. You can say it to the call takers on the support line. Some people feel resentful. They hate what they're doing. They may love the person, but they hate being in the role. That's hard, right? And then you don't acknowledge it, but you feel guilty, and that sets up its own trajectory. You need to, just make sure you're kind of step back out of yourself if you can, see yourself, hear yourself. Maybe ask other people in your life, how do I seem to you now? Am I different than I was before? right? Oh yeah, you're always exhausted. You never have anything positive to say. Oh, right. I mean, sometimes those awarenesses come from people outside us. It's once you know what is comforting for you, then you can start to identify where you're lacking those things and start thinking about how do I bring those kinds of activities, that kind of time back into my life so that I can feel more like myself. Because we've already shown you how, the activity of caregiving in the marathon leads to such illness and unwellness in so many areas of your life, right? And it can be, a number of things. These activities can be anything from getting outside for a walk to even getting outside on the back deck or on a balcony and taking 5 deep cleansing breaths. It's been demonstrated that those kinds of 5 deep cleansing belly breaths actually change the composition of the blood, activates a kind of little hormone that shoots some calming hormone at into the heart as the blood passes through, and the heart starts to slow down to out of maybe an abnormal range. It was really fascinating for me to read that, and you might want to just explore that a little bit. Why is deep breathing so effective? Well, it really has some important physiological effects. We all know that it could be quite a calming effect. So your person is asking that question for the 29th time, where you want to go, just a minute, and go outside and like breathe a couple times before you come back and maybe have to feel like you're losing your temper. I had heard of caregivers who would go into the bathroom with their pillow and scream into the pillow. Talk about a good physical release. That's okay too, right? Whatever. Sometimes it's those momentary actions that you need to just take to kind of bring yourself back to the moment. Sometimes you're going to need to take a weekend off, or right. And are there respite opportunities in your community that you can take advantage of? Are there those people who said, yeah, anytime you need some help, where they can come over and stay the night, or they can spring a morning so that you can go get your hair done in peace and get your nails done and whatever that might be, or go have a coffee with the rest of the guys. It is really important to your well-being and the well-being of the person you're caring for to integrate some kind of little activity into your day. And whether that's an hour of painting or sewing, whether that's a walk around the yard and, raking a few leaves, whatever that is, it's planning for it is more likely means that you'll be doing it. So I see where what my time is here. So I'm going to kind of just flip through some of these strategies, but you can, again, get this information from Family Caregivers, and you can watch this video again because it's being recorded, because there are sort of 6 activities that, or ways, strategies actually, of taking care of yourself. Self-care isn't necessarily self-improvement either, by the way. If you wanted to go and learn golf, I mean, that's great. But if it's, it doesn't have to be, right? It just has to be even something that brings you comfort. Maybe it's 5 minutes on your yoga mat, or maybe it's 2 minutes out in the garage lifting a weight. That's okay. Okay. It's meeting your needs so that you can feel more grounded. And here are those 6 self-care strategies: self-compassion, connection, personal supports, balance, resiliency, and an action plan. So self-compassion is being nice to yourself. You have lots of compassion because you're already being a caregiver. How can you be nice to yourself? How can you turn that towards yourself to say, you know what, this is really difficult, and but I'm managing. Anybody would find it hard right now. And you know what, you are doing a great job. If that means looking in the mirror to tell yourself that in the morning, right? First couple times it'll feel strange. It'll start to be a habit that you are looking after yourself, and you're verbally speaking to yourself. You're hearing your own words, and that's very powerful. It's also a way to forgive ourselves for our mistakes. We think we're going to be doing this role perfectly, and no, you won't, right? There will be mistakes, and it's okay. This self-compassion says, it's okay. I never knew how to give a needle before. I'll get better with time. It's important to sometimes flip those negative thoughts around and trying to find a positive in them. Yeah, just sorry, I was just thinking of a couple of examples, but when you say, oh, I'm obviously not very good at listening to my partner's aches and pains all day. The other part of that is, well, but I try, and I hold his hand, or I hold her hand, and at least I sit and listen, and that's good. There's a really great book by Dr. Kristen Neff called Self-Compassion. And so if you wanted to make a note of that, you might find that interesting reading. Then there's connection, right? Making sure that we have our social connections, families, friend, coworkers, former coworkers. If you set an hour aside a week, is that a time to make a phone call with that friend, or to meet that friend for coffee, or that walk around the block? If an action plan being number 6 on our strategy list, but I'm going to bring it forward, it's developing the action plan means you're taking, honoring that time, honoring yourself and the person that you're going to hang out with, and whether you talk your issues or not, right? It's important to maintain that, those social connections. Another way to do that is to allow people to share in the care, and that's where our Circle of Care program comes up. We found at the Alzheimer's Society, when we introduced it as a topic called sharing in the care, as opposed to let somebody take over, caregivers were more likely to actually share and not feel like they were, the burden should be on them entirely, and nobody could do it as well as they could. So there's definitely, ways to do that, starting sometimes with home care through the government, or asking friends to be available, or finding out what the community organizations in your area can do to help family caregivers. And of course, getting to a support group. I see the magic of it every time. And with family caregivers, you can go to as many online and in-person support groups in the month that you feel like you need. We also, encourage you to go to your Parkinson's Society and talk about, the disease-specific groups that are available. Just chatting with Kelly before starting today, and she was talking about the support groups that they run. There's also the exercise, singing and drumming workshops that go on, and that are, weekly or bi-weekly groups. Those are also ways to just get out of the house and connect. And sometimes it's the person with the disease, takes on the activity, and the caregivers move off and have a coffee and just relax, knowing that their person's having a great time. So those are all ways for you to increase your social time. Ask when people offer, take them up on it. And yes, create that circle of support and ask a friend to help you create the circle of support if you wish, or if you're, again, want to talk to a family caregivers coach, they can help you do that as well. Finding balance in your caregiving. Again, it's, easier said than done. But by, using the strategies of physical strategies that we just mentioned there, asking others, creating a list and having an action plan where there's some time for you every day of the week, it's going to help you in that exercise of balance that you can manage much better when you've taken time for yourself. We all know the stories of the oxygen mask in airplanes. And if you don't, here's what it's about. So the oxygen masks fall down in the case of an emergency on the plane. And what do the flight attendants tell you to do? They tell you to put your mask on first before you help the person. And why is that? If you can't breathe and you're panicking, how do you help the person who needs the help beside you? So it's a very good analogy for caregiving as well. And the oxygen mask in this case is the activities that bring you some joy, that bring you some respite. It is not selfish at all. It's not selfish. Resiliency is another skill that you can improve, again, with taking the self-care that you need, that it makes the harder parts of caregiving more doable. Resiliency talks about, like these spring branches that may get snowed on, but are able to bounce back as the snow melts and the sun comes out. So caregiving is going to be that up and down journey, and there will be crisis points and there will be calm moments. And how do you maintain your flexibility to ride those waves? And you will by being aware of yourself and making sure you're looking after some of your needs yourself. And as I said, you're not born with it. You'll learn it. You can learn it, and you will, by cultivating a positive outlook, by reframing some negative situations, right? What did I learn from that crisis? What did I learn from that argument with my person? Making friends with reality, right? Acceptance is huge, and it's extremely difficult, especially as we are facing, an end of life journey with a partner. And so reaching out then to support groups, to others who do grief counseling or grief work, and prioritizing your well-being and finding meaning in your caregiving role. Why am I doing this, really? How does this fit in with my values? And as soon as you can make that connection, sometimes the difficult parts are not so difficult anymore. And yeah, so lastly, it's about action planning, right? Take action. And for some of you, it might feel, oh, sure, that's really easy for her to say. How do I extract myself? And you're going to extract yourself with those small moments, those moments of 5 deep breaths out in the outside. A guided meditation that you can easily find on YouTube, which just, can be 5 minutes long, can be 20 minutes long. Those kinds of things. So in closing today, I'm going to pose one question to you. What small action can you take this week to support yourself? What will that be? How much will you do? When will you do it? How often will you do it? An action plan is more likely to be successful if those answers are written down somewhere. So it's, writing down what you think you're going to do, what you intend to do. How much of it are you going to do? How often? What time of day or evening will you do that? And one other point that I add in other circumstances is how likely do you think you're going to be to carry that out? All right, which is an evaluation of what are the barriers there that might prevent me from doing this, and how confident am I that I'm going to get this one little action done this week. So if that's, how confident do you feel? 8 out of 10, you're feeling pretty confident. 2 out of 10, not a hope in heck. Those numbers are important to look for. And then the strategy is what moves you from a 2 to a 3. So maybe writing out the list is all you can manage this week. And maybe next week, it's about, well, I'll do something on Wednesday and Friday. And that's okay, right? Those are all taking the small steps towards your own well-being. And that's what we want. That's what the person who's caring about you wants also, even if they're not very good at saying it sometimes. So I thank you so much for staying tuned and being part of the workshop today. I hope it's given you some validation of the amazing role that you're doing, of the depth of the empathy and compassion that you have in your heart. If Kelly has gotten any questions, I'm happy to stay for the next few minutes, if you're available to stay, to answer any questions. And on the screen right in front of you is the family caregiver support number. So please make a note of that and use it on those days that feel not so great.